So as we've heard, this report and this event exists for one simple, urgent reason: to fight back against that erasure by putting the lived experiences of trans people at the very centre of this conversation. Because right now, in this climate of rising hostility, we're living through an unprecedented crisis. In the last year alone, we've seen the Supreme Court ruling weaponized against us, a government enacting backroom bans on its own employees, and a media and political landscape where hostility towards trans people has become normalized. The UK has plummeted from a European leader on trans rights to being issued a red flag alert. But we're not here tonight just to recite problems as grave as they are. We're here because of the 4,008 trans people who trusted us with their truths. Their voices fill the Trans Lives report, and they tell us exactly what is at stake. Barriers to life-saving healthcare, the daily reality of transphobia, and a convoluted system for something as basic as ID that leaves people unsafe, afraid, and locked out of everyday life. Tonight, we're going to dig in to what this data actually means on the ground. And to do that, I'm joined by two of the people behind this vital work. We have Freddy Sperring, the researcher and writer of the Trans Lives report, who can talk us through the human stories behind the statistics. And we have Rachel Padilla, a policy lead who's on the front line fighting for the legal and political battles this report exposes. Wait, you all laugh. What face happened? Is Rachel not doing the work? So we need to. Come on. Maybe it's not just Rachel. It's all of the TransActual, also everyone in this room as well, but also no pressure, Rachel. Thank you. As one of the newer additions to the TransActual team. Alright, so Tammy has been very strict with how long we have. Apparently we have 25 minutes. I'm going to see if we can go for a bit longer because I also want to put in audience Q&A. Sorry, Tammy. I'm going to try and make it work. Like, I even looked at my watch, right? I'm going to do half an hour from now. Is that fine? It might be fine. We'll see. Okay. Alright, so we're going to get straight to it. Please join me in welcoming Rachel and Freddie. Really stuck back. Okay. Now I feel like a talk show host. Maybe this is my next chapter. I don't know. Alright. So let's start with questions for both of you. The survey was conducted before April 2025 Supreme Court ruling on the definition of sex in the Equality Act. TransActual's work in the past year has found concrete evidence that trans people have experienced further marginalization and hostility following the judgment and the EHRC's interim guidance. We've already seen the Prime Minister call for trans people to be banned from gendered spaces, and the government enacting a backroom ban for its own employees. Rachel, as a policy officer, can you talk us through what you're seeing on the ground right now? What is the most common and immediate impact this ruling is having on trans people's daily lives? And what is TransActual doing in response?
Yeah, so thank you so much for that question. Also, thanks so much for being here today. It's amazing to see the turnout. So I think the most immediate reaction from trans people is obviously the mental health effects of receiving the news that this interpretation of the Equality Act would be the one going forward. I think because it's inherently dehumanizing in its essence, but also because of, I think a lot of trans people anticipated that this meant a long fight ahead and many, many more years of uncertainty and of a lack of clarity. But the most material impact that we've seen, and this is really cataloged in the 3 reports that we produced, the Community Living in Fear, Segregation in Practice, and Gendered Spaces, which you can read on our website, is the way that trans people have been increasingly excluded and challenged on an institutional level, but also on an interpersonal level when accessing gendered spaces. So what this could mean is everything from like a change to a workplace policy, to somebody, a bystander, somebody you don't know at all, challenging you based on your physical appearance and basically accusing you of not being allowed in a certain space. We know that these effects are born most by people who are intersectionally marginalized, so disabled people, intersex people, people of color, and it's something that is not just restricted to, like a bar, but also happens in workplaces, etc. And there's a lot of very real implications of what that means for people. So I think I encourage everybody to go through that report and read some of the really harrowing stories of the way that before anything had even really been clear about how exactly this was going to crystallize or what exactly this meant, people felt empowered to go around and start challenging people on their right to use a gender space. And I will just highlight that this didn't just affect trans people, but actually a lot of non-trans, gender non-conforming people, or even just people who on that day were, this particular person perceived them to be gender non-conforming, have been challenged. We've received hundreds of reports of this. So I think that has had real implications for trans people's ability, as Helen mentioned earlier, to live their daily lives and to really navigate the public sphere at all, and has led to a lot of self-exclusion and increasing isolation.
Thank you. And, we can, as Helen already mentioned, there's a gap from when the report was done to, the Supreme Court ruling in the aftermath of that. And unfortunately, things have only become more stark. Freddie, I want to move on to you. As the researcher and writer of this report, can you tell us how the judgment is likely to make worse some of the key findings in the report?
Yeah, I think it is in a lot of ways really hard to know, because the Supreme Court ruling has affected so many things that it shouldn't have affected on paper. It's affecting how people are, in their day-to-day interactions, how people are affected at work. It's not just about the kind of spaces people are being excluded from. It's also showing up in a much more deeper kind of interpersonal way. So I think that is really, really difficult. I think it has got a lot worse, which I think is, to people in this room, it's not going to come as a surprise. And I think that would show up if we were to rerun the report today. I think that people would generally say a lot of things have got a lot worse. I think we're also seeing where people have kind of relied on goodwill, for example, if you have an ID that doesn't match what someone perceives your gender to be, we are seeing a lot more hostility in those situations where perhaps in the past someone would be like, oh, they're trans, they're going to let them through, I'm going to try and be understanding. The Supreme Court ruling in a lot of ways has given people the okay to cause difficulty in those situations. I think the other thing that's really, really important to highlight is the mental health effects of transphobia. As Zach said earlier, we did see about less than 10% of people who hadn't seen transphobia in their day-to-day life, probably in the news or other things. I think that's probably gone down massively. But what we also saw from those people who said that they had seen transphobia, that 99% of them said it affected their mental health. And so I think what is really scary is that transphobia is on the rise, and we don't also know if people are seeing transphobia multiple times, that's affecting their mental health more and more. I think that we probably can assume that would be the case. So I think that we are going to see people's mental health get worse as the rising transphobia and the kind of surrounding nature of transphobia now. Because I think maybe in the past you saw one news article, now it feels much more constant. So I do think that if we were to redo it today, a lot of things would get worse, and a lot of things that maybe you wouldn't expect that shouldn't be affected by the Supreme Court ruling, like transphobia on the streets, that have been affected because of the mood that it's created.
Yeah, absolutely, and it really just fits right square into the transphobic narrative, kind of across society and mainstream media. As we all know in this room as well. And the TransActual Gendered Spaces report actually provides some of that gap since the Supreme Court ruling in terms of really getting into the mental health impact on trans and non-binary communities as well. Okay, so for the second question, we're going to move on to looking a little bit more closely at healthcare. Freddie, the findings on healthcare are deeply disturbing. Over half of the respondents have experienced transphobia from a healthcare professional, and staggering 64% told us that they now avoid going to a GP even when they're unwell. People are literally avoiding emergency care. We're seeing that and we're hearing that anecdotally as well. The report shows that restrictions to care are becoming more common. Could you tell us about how this functions to exacerbate healthcare inequalities for the trans community, both in terms of trans people avoiding general healthcare and also the impact of being refused gender-affirming healthcare?
Yeah, and I think it's also really, really important to note that that was 64% of all trans people. But for people who have multiple marginalisation, it was much higher. So it was, I think, 67% for disabled people and 70% for people who identify as people of colour. So people really are not comfortable going to a GP. We're seeing massive amounts of people who are not comfortable going to a GP at all. And this is, of course, going to exacerbate people's healthcare inequality. If you don't go to the GP, you're not receiving the care you need. And that can be from having a nasty cold and not going in and getting it checked, from having something much more serious and not getting it checked, and something that could go on to exacerbate things that you already have, or be in itself an event that causes you long-term issues, which I think is really, really difficult. And we're going to see it exacerbated more for those people who have multiple marginalisation. So I think that is, really, really difficult. And what we know why people aren't turning up is experiencing transphobia at the GP is a key part of not turning up. Like half of all people said they've experienced transphobia at the GP. People aren't just not turning up because they don't feel like it. They're experiencing events that are not making them not want to go, and that's higher for people of colour. And it was 81% of intersex people said they'd experienced transphobia at the GP. That is so high. So what we are going to see is these people who've experienced transphobia, people who aren't going to the GP, are going to have worse health effects. But I think the thing is, for people who did manage to get to the GP, people who did manage to kind of pluck up the courage to go to medical care, we saw 799 people say they'd been turned away for non-gender affirming care at least once. So even if you do go, even if you kind of pluck up the courage, even if you make that plan, you go to the GP, you might not get the care you need. And this is not gender affirming care, this is just care across the board. This is like A&E, this is GP, this is other things, not to mention all the other problems like transbroken arm syndrome. So I think that the issue is that people are not having good experiences at doctors, they're not getting the care they need, they're getting denied the care they need, and that is causing people to not go because they know they're not going to be taken seriously. And that is, of course, going to mean that people don't have the medical care they need, and is going to cause issues.
Yeah, and you've really hit on about the vital nature of why our work needs to be intersectional. How when we talk about trans and non-binary communities, we really need to dig in about who exactly that we're talking about. Because if we're not being specific, or if we're not engaging in campaigning and advocacy work that targets specific communities, whether that's disabled trans people of colour, trans people from faith backgrounds as well, and just a whole heap of other intersections, we're doing a disservice to our communities, and really we're going to be leaving people behind. And so thank you for kind of really highlighting why that's really important.
And can I just wanted to say, I think one thing that is really brought to light by this report, and which I think has been under-researched and just under-remarked in a lot of other contexts, is specifically this facet of trans healthcare, which is navigating the whole rest of the healthcare system that everybody else has to navigate, but having the added weight of bringing that trans experience. And I say this as somebody who has struggled so much navigating the healthcare system, not even related to transition care, but just for normal day-to-day things, or when your body just is this way now, and you're approaching a doctor and saying, I need you to treat me as I am. These are the hormones my body produces or doesn't produce. This is the way that my body looks and acts now. You need to treat me with respect and make sure that I'm healthy. And people are actually saying, I want nothing to do with this. I know nothing about this, and I refuse to educate myself on it. It's really horrifying, and I think it's something that is faced by a lot of other marginalized groups. Women are used to not being listened to by their doctors, people of color. We know statistically that they're less likely to get the care that they need. And I think I'm really glad that this report focuses a bit on that aspect of things, because we're so used to talking about transition-related care, but there's this whole other aspect of it.
absolutely, and certainly exacerbated if you're facing other marginalizations, as we know and have seen as well. Okay, so we're going to move on to question 3 around kind of looking at ID and safety and recognition. Um, this report highlights an incredibly important tension. On the one hand, the UK system for legal gender recognition is a really convoluted process that few can access. On the other hand, a huge number of respondents, 40% actually, said that they would prefer not to have their gender listed on their ID at all. And this really gets to the heart of the debate within our own community. Some people are fighting for better access to gender recognition, like a simpler process for a gender recognition certificate, or for the option, or to have the option of X on passports, while others are pushing for a future where the state simply doesn't need to know our gender. So Rachel, can you briefly outline the impact of not having an ID that's aligned with your lived gender, and how TransActual's policy work really navigates these difficult but equally valid demands from our community? It feels like a tricky question because it almost feels like 50-50.
No, I mean, I think it's a really important question. I think what I would say off the bat that connects the two, wanting no gender marker on your ID versus wanting better gender recognition is basically like self-determination and autonomy and the ability to make decisions about your own gender, where that appears, who knows about it, and who doesn't. I think that something that is often remarked upon is the importance of, or the effect actually of the weaponization of data that is collected about trans people against us. I think somebody earlier mentioned the Lemkin Institute, which is an organization that kind of is like a watchdog when it comes to genocidal practices. Issued a red flag alert for the UK on trans rights last year, and one thing they cited specifically is this mechanism of genocide, which basically serves to deny people their right to identify themselves, or to have an identity, basically. And I think that what we're seeing in the UK is a really active effort on many different levels to kind of erase trans people in data, and to I think to artificially suppress the number of trans people that there are here, so that we can kind of pretend that they don't exist. And two, to make it more difficult, so that even if you do live in your if you choose to transition and you live in the gender that you are, you will then have a piece of ID that outs you wherever you go, and that is by design. They want you to be outed when you go to access, healthcare. When you go to, as somebody mentioned earlier, just going to the bar, or Zach mentioned earlier, going to the bar, and that's a very real consideration for people, and it means that they're really being pushed out of public life. And I think it's worth mentioning that the government commissioned a review of data on sex and gender called the Sullivan Review, which was led by somebody with direct ties to anti-trans groups, who basically advocated for an approach to data collection which would only collect data on sex assigned at birth. And this is really being integrated on a government-wide level to effectively erase trans people. So I think it's a really dire situation. And I think what we really need to see is, one, more simplified processes for changing gender, obviously. But I also think that in a supposedly gender egalitarian society, we do need to adopt data practices that decenter gender, and certainly like when they're rolling out new systems like the digital ID, which is was going to be mandatory for all, that is something that should not include your gender at the forefront, because at this point in our society, if we claim to be a gender egalitarian society, why is it that relevant that it needs to be everyone needs to be beaten over the head with your gender? And I think, it's an inherent part, really, of self-determination to decide who you share your gender or your gender history with, when, and and why. And I really hope to see that us move forward on that hopefully soon.
I think something that as well, like leading on from that point, is with the Supreme Court ruling, is that we are saying, when we ask people like, why do you want to have your gender on your ID, why do you not want to have? A lot of people found safety in having an ID they can pull out and be like, I belong in the space. And I think that with the Supreme Court ruling, we're losing that kind of freedom to be, oh, my gender's not important, I don't want to have it listed, which is probably where I would land, versus the feeling that with the increased gender scrutiny, with the massive, eye that is on trans people having, an ID that you can just say, leave me alone, I'm meant to be here, which is in a way a privilege, but also is, fast becoming something that people really need to feel safe. So I think we are entering a world that has massive scrutiny over gender and over gender presentation, and that is going to force people to have IDs that they can pull out to kind of justify their existence, which is a horrible place to be in. It would be nice to live in a world where we could all not have to do that in order to justify being in a space, but it's kind of where we are.
Thank you. We've spoken a lot this evening, from hearing between Helen and Zach and, this panel as well. But I wanna tap into a little bit of hope, because we have so much of that in this room, and in the work that we're doing and in the advocacy that we're doing. The report ends with a powerful statement. It's not too late to change the UK's trajectory. But with 58% of us feeling less hopeful, and with events since the survey making things feel even worse, hope can feel like a really fleeting thing or a difficult thing to hold on to. And, for many of our community members here tonight, who are living through this reality every day, and for our allies in the room as well who want to help, a question for both of you: which of our policy recommendations do you think should be our priority? And actually, I'll wait for the second question. The first one, which of our policy recommendations do you think should be our priority? Maybe as an organisation as TransActual or across the LGBTQ+ sector?
I think I would say that something I really love about working at TransActual is that we do try to be extremely cross-cutting, and it's because the attack on trans rights cuts across so many different aspects of our existence. So I think our response works on all of those different dimensions as well. But I think where there's maybe the most potential inroads right now is actually healthcare, and specifically because of the release of the Levy Review, which was a review commissioned by NHS England of gender care across the country, and was pretty decisive in saying that the gender care system right now in the UK is fundamentally failing trans people. Waiting lists are a decade in some places, and actually a lot of our recommendations in the report mirror the recommendations that were made by Dr. Levy in that review, including obviously reducing waiting times, but also kind of moving away from this centralized model of gender identity clinics, and moving to more local provision, but also and on the note that I was saying earlier about non-transition related care, of ensuring that there's actually training for NHS staff across the NHS on dealing on treating trans patients sensitively. So I think that it feels right now like not only possible for there to be improvements in healthcare for trans people, but actually it seems almost inevitable. And in fact, the NHS has actually accepted has accepted the findings more broadly, but has kind of committed already to some of those improvements. Not all of them, and maybe not all the ones that are the most important, but some of them. And hopefully we'll move in a good direction there. And I think the reason that kind of bodes well is that at least on an individual level, hopefully it will restore a bit of a sense of autonomy and control over one's situation, even though maybe as a community we recognize that our ability to navigate public life is getting more restricted, but hopefully, at least as individuals, we'll have a bit more control over our lives.
Now, I feel like that moves me on nicely to my final question before we have some time. Please come in for the audience Q&A. So, yeah, what do you both think could be the single most important action that people in the room can take, or the one reason we should keep fighting, even when the situation feels this desperate? I know it's hard, but one thing.
I think one thing that I find and one thing that I talk to, because I talk to quite a lot of people doing things in different areas, and I've been to quite a lot of conferences and different things. And I think the one thing that always keeps me going is that you kind of have to just like keep your own corner good. Like I think everyone here has probably got different spaces they're in, different places, different workplaces, different charities they're involved in. I think if each person kind of works to make sure that their own spaces, the places they're in, are as good as they can be. Like I was at a conference, I bumped into this amazing midwife who was doing some amazing work on, people who are giving birth, making sure that there's inclusive language, making sure people are comfortable, making sure that, the inequalities that you see in the midwife space aren't continuing. And it's something that I never really thought about, and it's something that I never really explored. And it was just so nice to know that there's someone out there being like, don't worry about the midwives. I thought, I'm doing my bit. So it's kind of nice. I think sometimes it's so hard, like, especially when I was doing this report, I looked at it and I was like, this is so bad, this is so terrible. But just knowing there's like one person out there working with midwives and that they've made a noticeable difference, that's so big. And if we all did that,
Yeah. I think, it's really looking at analysing what our spheres of influence are, whether that's our family, whether that's our friends, whether that's our workplaces, and really looking at, well, what can we do individually to help move the needle? And I think that's a really great example. Thank you. Rachel?
Yeah, I would say, the thing that I would encourage all of you to do and to take out of this room is basically to take the findings of this report and all the conversations and things that we've had in here and to actually share them with people. If you do work in the sector, share them with MPs, share them with other people in the third sector across, not just on the trans issue, but people who work on all sorts of different issues. But I think also just like talk to your neighbors. I've been really surprised. I was just on a trip in Morocco with 10 other girls, and we were just sat around the table, and I got to talking about trans rights, and they were all just like, I actually can't believe it's that bad. Like people don't, I think, realize how bad it is, and so I think just telling them helps to kind of, I think helps to combat this myth that like this is like kind of a niche issue, or that it's something that only affects trans people, because I fundamentally believe that like trans people are the canary in the coal mine for the rollback of so many rights, on women's rights, on the rights of people of color, on the working class, and we're an easy kind of field of experimentation because we're such a small community, but I think ultimately like that will come to bear for everyone else. But I also think that that's why it's so important for us to all keep fighting, because ultimately we're doing it for each other as much as we're doing it for ourselves, and I really believe in that. So yeah.
Thank you so much for